Good afternoon, I'm Giovanni Dennis with the Midday News. A special welcome if you're joining us online at onespotmedia.com. Vaccinations are currently underway at the Good Samaritan Inn in Kingston. It's one of 70 locations island-wide where inoculations against COVID-19 are happening. The Health Ministry says it's hoping to vaccinate over 3,000 people on today's first day of vaccination. Now, our news team was at the location in Kingston this morning and observed the first vaccination. Marcia Thomas Yetman, the first Jamaican to be given one of 2 doses of the Oxford AstraZeneca vaccine. She's a senior public health nurse.
My greatest consideration was my fear of needles. That was my thought, God, injection. But then when I think of the benefits, that took precedence in terms of what it's going to do for me and my family and for the other persons that I may come in contact with.
The second Jamaican, Professor Denise Eldemaya Shearer, patron of the National Council for Senior Citizens.
Thank God. It's a relief. It was an awesome experience. The organization here is fantastic. Keeping also with all of the protocols, so the social distancing, the mask, and of course the sanitizing. The shot does not hurt. Little burn does not hurt, no more than any other vaccine. And it's the start of freedom.
It has been raining all morning and it is still raining here at the Good Samaritan Inn in St. Andrew, perhaps symbolizing showers of blessings as Jamaica begins its vaccination program with the hope that it will wash away the devastation caused by COVID-19.
It is a historic day and it represents a major shift in the approach now that vaccines are available, and we believe could signal the beginning of the end.
Former Prime Minister Bruce Golding managing to crack a joke.
The only criticism I have, Minister, is that unlike when you go and give blood, they didn't offer me any red stripe.
But then, on a serious note,
All Jamaicans, as soon as the opportunity is available, take the vaccine. Don't pay any attention to the propaganda, the conspiracy nonsense that Bill Gates trying to kill our black people and all this rubbish.
another former Prime Minister, P.J. Patterson,
there is no reason whatsoever why people should not accept the vaccine when it is available.
the move to have influential people like the former Prime Ministers is deliberate. There are 70 other vaccination sites island-wide with over 3,000 persons scheduled to get their first doses of the vaccine today. The second dose will be administered in 8 to 12 weeks. And today is exactly a year since the first COVID-19 case was reported in Jamaica. In the Midday News special report, we look at the devastating impact the pandemic has had on the lives of some Jamaicans over the past year. Now, according to social anthropologist Dr. Herbert Gale, COVID-19 has ripped through the belly of Jamaicans. Sandy Williams has our story.
It is officially 1 year. Jamaica recorded its first case of COVID-19. 36 days later, 100 confirmed cases were reported. As the days progressed and the case count increased, the government relied heavily on restrictive measures such as lockdowns, quarantines, and curfews to contain the spread of the virus. The implementation of these measures resulted in a slowdown or, in some cases, a complete stop in production and consumption activities, forcing several businesses to close their doors and sending thousands of workers home.
I used to work at a basic school, and it is a private institution, so therefore I am not working because COVID, so they have to close down the school.
I just out here at daytime, and when we're tired to sleep, or tired to play a card, or play a domino, I do some carving, just carve and hang up. But I have a rough time, and the roughest time I ever feel,
The men still are the primary producers. And so from the male fertility preliminary study, what we're seeing is 22% of males have to work every single day in order to provide for themselves and family. 22%. That is large, which means that when you have a COVID, which
The study also showed that 54% of people who are affected do not have any savings. According to social anthropologist Dr. Herbert Gale, a large proportion of the population have been affected.
the damage to the economy brought on by COVID has really worsened the situation for a lot of people who are already poor. COVID has ripped through the belly of Jamaicans, believe me, and I'm not trying to create any point.
For example, Gervin Roof, who is a craft vendor in Port Antonio.
If I see a sale, sometimes it just fish stop a gap. If you carve in either self, you can sell for 6,000, and somebody give me 2, I just sell if you survive, you know, because I know I can make it back. So I just let me survive after sometimes, just give it something cheap, and then maybe go to the supermarket, go buy a little something can warm, you know.
According to the Economic Commission for Latin America and the Caribbean, ECLAC, more than 30 million people could fall into poverty in the absence of active policies to protect or substitute income flows to vulnerable groups. Given the economic damage caused by the pandemic, Dr. Gale says the road to recovery will be difficult and will require a lot of unity.
10 years from now, many of us will not repair, neither family-wise, nor business-wise, nor whatever. Some remember, not all of us, because some businesses are going to just balloon because of COVID, because the market is a demand and supply. If you have a supply that people need during COVID, you're going to do well. If you have the kind of job that does not necessitate survival, you're going to struggle at this point. But it's going to take us a lot of unity.
Sandy Williams, TVJ News.
Jamaica's health system will be boosted through assistance from the Pan American Health Organization, PAHO. The announcement was made at this morning's post-cabinet press briefing. According to Information Minister Favour Williams, the assistance from PAHO will be on the technical front. She also noted that a voluntary contribution to the organization of $800,000 has been approved by Cabinet.
The coordination between primary and hospital care and the organizational arrangements of the regional health authorities needed to be simplified and reoriented towards health outcomes instead of financial and administrative outputs. The infrastructure of hospitals and medical equipment at the priority facilities needed improvement to ensure that delivery of health services were efficient and cost-effective. PAHO will provide technical assistance in the development of the primary healthcare policy and strategic plan and the development of an implementation plan for strengthening the steering role of the Ministry of Health and Wellness.
The PAHO assistance will also aid in streamlining the roles of the 4 regional health authorities, conducting of a needs assessment of technologies and the development of a health technology framework in the public health sector. Now also included is the development of a policy for human gap analysis, a strategic 5-year policy, and a review of the National Public Health Lab. Procured as the country continues to fight against COVID-19. Information Minister Favour Williams says Cabinet has approved a contract for additional beds to deal with COVID patients in the Southeast Regional Health Authority, SERA.
Cabinet gave approval for the supply and installation of 175 hospital beds for the Southeast Regional Health Authority, SERA, in the amount of $70,897,356.25, including GCT of 15% to Advance Procurement Limited.
808 new COVID-19 cases were recorded in the last 24 hours. This pushes the number of confirmed COVID-19 cases to 28,273. Kingston and St. Andrew recorded the largest number of new cases with 216, followed by St. Catherine with 142 and St. James with 57. Meanwhile, there were 3 deaths recorded, bringing the island's death toll to 463. All 3 deaths were previously under investigation. The Health Ministry is also reporting that 277 people have been hospitalized, 31 are critically ill, and 38 are moderately ill. The number of active cases is now 12,934. And it's now time for a break here on the Midday News, but please stay with us. We'll have much more when we return. Welcome back, and we're continuing the news. More than 28,000 confirmed cases of COVID-19 have been recorded in the island since the start of the pandemic, and over 460 lives have been lost to the deadly disease. On Monday, Prime Minister Andrew Holness said the country could go back in lockdown if the numbers continue to rise. Now, reacting businessman William Mafood is adamant that a lockdown is not enough. Codian Barrett has this follow-up.
Prime Minister Andrew Holness hinted that a lockdown could be implemented if the number of COVID-19 cases continues to surge. But businessman William Mafood believes a lockdown by itself would be inadequate.
A lockdown is not going to be the answer. It has to be for the next 9 months or a year. What is the government going to do differently to keep this thing under control? You have a lockdown for 2 or 3 weeks. The numbers come down. But what is going to be different?
Public commentator Dennis Chung supports Mr. Mafood's position.
If the economy actually goes into lockdown, right, then you're going to have a significant impact on people, and it's going to be an ungovernable situation, I think, because government is also going to become more ineffective because they're not going to have the resources to carry out a lot of the things they need to think about. So.
Meanwhile, head of the Caribbean Immunization Technical Advisory Group, Professor Peter Figueroa, is of the view that the government should enforce a lockdown as the country starts its vaccination drive.
What that does is it buys time. It gets the reproductive number, that is the number of persons infected by any one person who is infected. It reduces it from, say, 2 people being infected to only 1 or less than 1 person being infected.
He believes the crisis currently facing the health sector is a major concern and that quick actions are needed.
For the first 2,000 health workers tested, 500 of them were positive. Yesterday we learned from the nurses that perhaps 200 nurses are have to be in quarantine because they're infected. The hospitals are under tremendous stress, so we do need more decisive action now.
Today marks the 1-year anniversary since the country recorded its first COVID-19 case, and according to Professor Figueroa, the vaccine now available is a game changer.
The vaccines definitely are an opportunity for us to help better protect ourselves from becoming infected. And once we can begin rolling it out efficiently, we will see an effect on reducing the spread.
Codian Barrett, TVJ News.
To other news now, sections of Augustown in St. Andrew are under lockdown as members of the security forces combed the community for gunmen who engaged them in a major gun battle this morning. 5 of the suspects were killed and 5 weapons, including an assault rifle, seized. The dead have been identified as Akeem McLean, otherwise called Tilo, Colin Mingos, otherwise called Speng, O'Neill Dixon, otherwise called Dell, Tafari Dell, and Julani Palmer. TVJ News understands that a Jamaica Defense Force soldier was shot and injured in the incident. It's understood that members of the police and military carried out an operation on Bedward Gardens shortly after 4 o'clock in search of men who fired on a military checkpoint earlier this week. During an exchange of gunfire, the men were shot and the firearms seized. Police and military personnel are conducting house-to-house searches for other suspects at this hour. Now, the area has been tense since the fatal shooting of a popular pillow vendor from the community on Princess Street in Kingston last week. One of the suspects in that attack was killed by a policeman. It's reported that the attackers originated from another community in Augustown. Residents of Whitfield Town in southwest St. Andrew say they are living in constant fear from gun violence. Councillor for the Whitfield Town Division, Eugene Kelly, says shootings are at an astronomical level. Codian Barrett reports.
The Whitfield Town Division in St. Andrew, though small, is carrying a hefty crime rate.
Of the 40 roads in Whitfield Town, we're talking about an area that is probably about 5 or 6 roads. Whitfield Avenue, Alexander Road, Rodney Road, Metcalf, Burt Jordan, Ashley Road. So it's a small area, and we have seen shootings on almost a daily basis within the last 2 weeks.
The situation has left residents traumatized and business owners closing their doors.
Yes, there are persons who are just fearful. Remember, a number of the residents are living in a board housing, and so the fear of getting killed while sleeping on your bed. Some residents have not slept on their bed. Persons are moving, business places are closing down, and this is in a corona time in which the economic situation is already very dire.
The shootings have also affected students who have online classes. While he acknowledges that there have been an increase in patrols, he's calling on authorities to increase the resources allocated to the police in the area.
We're in need of community policing, real policing that will get at the heart of the issues, get real intelligence, because the business of patrolling is just not effective.
Codian Barrett, TVJ News.
The government has responded to calls for an increase in the $50 duty-free limit to import personal items. Speaking during the budget debate in Parliament Tuesday, Finance Minister Dr. Nigel Clark said given the country's current economic situation, increasing the threshold is not part of the plan at this time.
The effect would be that Jamaicans could import higher valued items without duties and taxes being levied on them. My fellow Jamaicans, I understand the request, but at this time, when the government's revenues have fallen precipitously, when we're still in the grip of the pandemic and risk remains elevated, where the government is dependent on a one-off dividend of $33 billion to take us through the upcoming fiscal year, and we won't have this revenue next year, it would be unwise to erode our revenue base with such a move.
In 2014, the threshold was increased from $20 to the current $50 duty-free limit to import personal items. PricewaterhouseCoopers (PwC) has welcomed the introduction of the de minimis value of $500 on exports, which was announced by Finance Minister Dr. Nigel Clark on Tuesday. PwC says the announcement will allow small businesses to be more competitive, particularly when trading on online shopping platforms. The PricewaterhouseCoopers says the Customs Administration fee, CAF, on export declarations has been a significant deterrent for micro, small and medium enterprises exporting small value items in low volume. It noted that in some cases, the CAF can cost nearly as much as the items being exported. Historically, a Customs Administration fee of $3,000 has been imposed on each export declaration filed with the Jamaica Customs Agency. That fee will no longer be levied with effect from April 1, 2021 on export declarations with a value less than $500. Now, export declarations for exports valued at more than $500 will continue to attract the administration fee. This measure is expected to result in a loss of tax revenue of Jamaican $70 million for 2021-2022. In the meantime, Dr. Clark says the government's support or COVID-19 support grants, Set Cash and Best Cash, will continue until June. 50,000 Jamaicans are expected to benefit from these grants.
The Serve Jamaica program will provide $3 billion for the continuation of the CARE programs, set cash unemployment support grants, that support those who earned below the income tax threshold, who have been unemployed as a result of COVID-19 pandemic from all sectors, and the CARE program's best cash grant that supports tourism employment, Madam Speaker, and these amounts will be paid in the quarter April, May and June.
And here's a preview of what's coming up in this evening's Health Report.
In the next edition of the Health Report, we'll look at COVID-19 and suicide in young people.
From in the early years, you should allow your children to talk to you, to tell you what's bothering them, to lend a listening ear. And remember that children model behavior. So if they see the adults stressed out and anxious and depressed, they are going to feel that way. So it's going to be important that adults, parents, don't act out their feelings around their children. Very important that they be the adult and be the driver and model appropriate behavior.
That's the Health Report this evening in Primetime News. And now for today's Healthy Living tip. Talk to your child. Respond quickly to suicidal signs. Ask questions in a non-judgmental way. And contact a mental health professional.
In news overseas, the critical screening of potential jurors in the high-profile trial of Derek Chauvin, the former Minneapolis police officer charged with George Floyd's death, is moving full steam ahead. More from the CNN.
You have been summoned, as you know, as potential jurors in the case of State of Minnesota versus Derek Chauvin, which is a criminal case related to the death of George Floyd.
Potential jurors questioned by the court, the state, and the defense.
Can you be fair to both sides and set aside any opinions?
Yes. So far, 3 jurors have been selected. 2 males that appear to be white in their 20s or 30s, and a woman who appears to be biracial in her 20s or 30s.
Moving on this jury.
Awesome.
In the meantime, you're not an investigator. Do not go out looking. Do not avoid all media to the extent you can. And then we'll see you back here.
Some potential jurors saying they're hesitant to be involved.
I read in the article, or the information you sent us, that jurors' names will be publicized after the case is done.
At some point, yes.
I felt, well, if our names are publicized, could we become potential targets for certain organizations?
And some dismissed, admitting they already have personal opinions on the case.
You would have an opinion about any witnesses that the defense might call, especially if they're police officers.
Yeah. I'm going to excuse you from this panel. I think there might be better juries for you to sit on than going to a case of this magnitude.
And to news and sports, Sri Lanka have been dismissed for 232 after electing to bat in the first one-day international against the West Indies, this at the Sir Vivian Richards Stadium in Antigua. Openers Danushka Gunathilaka, 55, and Dimuth Karunaratne, 52, got the visitors off to a strong start, posting 105 for the first wicket. However, the Sri Lankans lost 5 wickets for 46 runs to be pegged back at 151 for 5. Jason Mohammed took 2 wickets at sports time. Now, the Windies playing 11 includes Alzari Joseph, Romario Shepherd, Jason Mohammed, Karen Pollard, Darren Bravo, Jason Holder, Evan Lewis, Akil Hussain, Shea Hope, Nicholas Puran, and Jamaican Fabian Allen. And that's the Midday News. I'm Giovanni Dennis on behalf of the news, sports and production teams. Have a good afternoon.